As the years go by, many men notice that filling the penis with blood quickly no longer happens as easily as before. WHATHN seemed automatic, now requires more effort, and in some cases, become frustrating. This happens because blood vessels, low elasticity, and hormone production is no longer thesis. But this doesn't mean there's no way to regain potency in dimro erection even after 5'5". I'm Julia Siller, a urologist, and over the years, I have treated many patients facing fishang. Most believe it that the solution was only a medication, but there are strategies and simple daily changes that make a big difference. Function can be optimized with right choices, allowing for firmer and in this video, I'll explain what every man over 55 needs talk no to improve erection without relying solely on medication. Blood circulation, daily habits, and even stress control have a direct impact on performance with a future changes. It is possible to reverse this condition and enjoy a more active and satisfying sex life. Before continuing, you are already subscribed to channel so you don't miss Newton on health and sexual education. This video provides useful information. You like it, so that more and more people can access this message. I want to hear your opinion in the comments. Type 1 if you like the topic, or 0 if you have a suggestions to improve the content here. Participation is essential. Many change soccer in the body over time, and erectile function is no exception. 55 or older, it's normal to notice that erections didn't happen as easily as before. This doesn't mean something is wrong, but rather that the body is going through natural adaptations. Blood circulation is no longer as efficient in testosterone production. Gradual lid creases and even the brain's response stimuli may become a bit slower. A lot of this directly impacts the firmness and duration of an erection. Additional live blood vessels, some elasticity making it harder for blood to flow, tough penis before just an exciting thought was enough to trigger a reaction. Now it takes a little more time and stimulation. Another important factor is conditions like hypertension. High cholesterol and diabetes, which become more common with age, can also interfere on arteries are compromised. Blood has more difficulty reaching where it needs to go in directions, lose strength. That psychological factor also plays a role. Anxiety, daily worries, and the fear of not performing as before can become as significant obstacles. The body responds to what the mind feels, and the more attention and pressure there is theory, but none of this means that sex life isover on the tantry. Understanding the set changes is first step to adopting strategies that help improve circulations. Store more satisfying erection stow. You strengthen your sex life. Do you independ your connection in your relationship? In my digital book, Rediscovering Intimacy, Healthy Sexuality After 60, you'll find practical guidance in reigniting desire, overcoming physical and emotional challenges, and experiencing more pleasurable moments as it through the link in the first pinade, a new canad.com and comment, and see how to transform your love life, a strong and lasting direction to pawns directly on any essential factor. Blood circulation. When there is a good blood flow to the penis, the corpanos quickly ensuring firmness and support, but when this flow is compromised, an erection may take longer to occur, be weaker, or not last as long as desired. This happens because blood vessels lose efficiency over time and artery elasticity decreases, making it harder for blood to pass through. Another important point is nitric oxide production, a key substance for relaxing blood vessels and didding the arteries in deepness. The release of the substance is reduced, which is common in men with high cholesterol, hypertension, or diabetes. Circulations not occur optimally, and the erection is affected. Additionally, poor circulation can result from unhealthy habits such as sedentary lifestyle, a decline in bad fats, and smoking. Taking care of blood circulation is not just a matter of sexual performance, but also overall health. The heart, brain, and muscles all need good blood flow to function well. Thibitar, the circulation, better thibity's response and elastics, including direction quality. Smell routine adjustments can make a big difference in vitality and performance. Many men believe that losing rigidity or difficulty maintaining unerection are just inevitably consenting, but in most cases problem lies in daily habits. Small sizes over time may be undermining waxal health without being noticed. A sedentary lifestyle, for example, directly affects circulation, making blood vessels less efficient and reducing blood flow to the penis. Those who spend too much time sitting and do not engage in physical activity unknowingly be making their erections more difficult. Another silent enemy is diet. Excessive consumption of fried food, sugars, and ultra-roast foods contributes to feebled up of fatty plaques in the artery, impairing blood circulation and reduced citric oxide production, a key substance for blood vessel dilation. This means that Every meal high in bad fats could sabotaging erection, firmness, in the future. Excessive alcohol consumption and smoking are also major villains too. Alcohol can harm the nervous system and reduce sensitivity, while smoking damage exercise, making blood flow more difficult. Stress and lack of sleep complete the list of silencers, raising in cortisol levels and disrupting hormonal balance. Identifying these habits is the first step to regaining sexual potency. Physical activity is one of the most powerful allies for sexual health. In addition to strengthening the entire body, certain exercises help improve blood circulation, ensuring a more efficient flow to the penis. The first major benefit of exercise is heart stimulation, making the blood pump more efficient and helping to keep arteries clean. Walking for at least 30 minutes a day is enough to increase the circulation and reduce the risk of vascular problems that affect directions. In addition to walking, strength training also makes a difference. Weight training gamros testosterone production and strengthens the pelvic region. Provided intercourse compound exercises such as squats and deadlifts are excellent for stimulating hormone production and activate tingerian in the lower body. Kegel exercises are another essential tool. Fumon know this, but the pelvic floor musculus improves erection quality and event ejaculation control. They are simple to practice and candonini, where just contract the muscles, stop urine flow, hold for a few cans, and then relax with regular practice. Difference in erection firmness becomes noticeably. Incorporating these successes into a routine is an effective strategy to enhance performance. Nutrition has a impact on erection quality. What a person eats daily can either strengthen or harm blood circulation and the production of hormones responsible for sexual desire and performance. To ensure that blood flows freely to deepness and fat blood vessels remain healthy, it is essential to consume nutrient foods that promote arterial dilation and hormonal balance. Foods rich in nitric oxide are among the most important. Watermelon, spinach, and a rug help relax, allowing blood to circulate. Another fundamental category includes sources of healthy fats, such as avocado, olive oil, nuts, and omega-3, rich fish, like salmon, K. These fats support testosterone production and combat inflammation that can impair function. Red fruits, such as strawberries, blackberry, and blueberries, are powerful antioxidants that protect blood vessels from premature aging. Meanwhile, cocoa are found in dark chocolate, stimulate sarcolin, and improves mood, helping to reduce stress. One of the biggest in a miss-up erections, in the other hand, reducing consumption of sugar-fried foods and adulter roast foods is essential to prevent fat buildup in the artery. Small dietary changes can make a big difference in sexual potency and overall vitality. The body responds to stress as if it were in danger, releasing hormones like cortisol and adrenaline. This reaction can be useful in extreme situations, but when it becomes constant, it starts causing damage, including tohog fuel function, excess cortisol. With testosterone production, it reduces nitric oxide release, which is essential for blood vessel dilation and blood flow to the heath. The result is weaker erections and greater difficulty maintaining. Performing in turn acts as a cycle. Worrying about performance, fear of fail, and accumulated tension create a vicious cycle. The more one thinks F-Buth's problem, the worse it gets. A raising mind prevents the body from responding naturally to sexual stimulation. This explains why many men experience action failures precisely when their wrenches are under pressure. To break the cycle, relaxation techniques such as deep breathing and meditation help lower cortisol level. Enjoyable activities such as outdoor walks and leisure time also make a difference when stress persists. Seeking psychological support may be the best solution. Mental tranquility has a direct impact on their response, allowing desire and erection happen more naturally, and with it pressure beyond diet and physical exercise. Some natural techniques can improve circulation and promote stronger erections. One of FEMA penile massage, which stimulates blood flow in the area and helps oxygenesis. Appliantal pressure with circular motion scan help dilate blood vessels, making directions firmer. The use of warm compresses on the pelvic region is another good strategy to activate circulation. Hydrotherapy is an effective alternative. Violating between hot and cold water jets in thesoer stimulates the action and contraction of blood vessels, acting as a natural exercise to improve probocirculation. This can be done directly in the abdominal region, and thighsacious areas contain important arterious supply blood to the penis. Exposure to sunlight at appropriate times also helps, as it increases vitamin D production, which is essential for testosterone regulation. Another interesting technique is practice in speech stretches for the pelvic region, which improve flexibility and blood circulation. Sleeping well is one of the most underestimated natural methods. Good sleep regulates hormones and promotes trick slide production in Sharinga, more efficient aerial response. Small daily adjustments can bring significant interest without the need for medication. Regression difficulties become frequent and persist despite lifestyle changes. Itis. Time to seek help from a specialist. Dysfunction can be a sign of a deeper issue such as cardiovascular bulls, hormonal imbalances, or a venereologic conditions. A urologist or endocrinologist can evaluate the situation and request tests to understand the root cause of the problem. Blood tests are fundamental for checking testosterone, cholesterol, glucose, and other markers that influence sexual health. In some cases, the doctor may recommend hormone replacement therapy if testosterone levels are too low. Another approach is PD-5 inhibitors, such as copantalo, which help improve blood flow to the penis. However, this medication should only be used with a prescription as they have a contradiction and can interact with their medications. In addition to conventional treatments, some alternative therapies, such as vasodilation, natural supplements may be recommended depending on each patient's needs. The most important thing is to understand that seeking medical help is not a sign of weakness, but rather a fundamental step in restoring sexual health. Specialized care can provide effective and safe solutions tailored to case maintain quality after the age 55 depends on several factors. And now you can know that there is a lot that can be done to improve circulation, strengthen blood vessels, and regain confidence. Small changes in diet, physical exercise, and stress management make a significant difference, and when is seeking medical guidance is the best path to safe and effective as solutions. Want to know were you aware of the importance of nitric oxide for vaccine? Quality of your answer in the comments. This video provided useful information for you. Like it so that more people can access this content. Your support is essential. Torrenthin the channel and spread this knowledge to those who need it. And if you want to keep learning about health and sexual performance, watch the other videos on the channel. There are many more tips and insights to help you improve your intimate life safely and effectively. Subscribe to the channel and turn on notifications so you miss upcoming content.